talking about the anatomical terminology that we use to describe movement. If you watched the video of the yoga board that I did about the language of movement, this is just going to solidify some of those terms so that kinesthetically you can start to really hold on to what each movement is and what the name is for it. So, of course, we always start in anatomical position, and that just means feet hip distance apart, flat on the floor, arms down to the sides, and the palms are facing forward so that your forearm bones are parallel. Makes it easier to identify some of the movements of the forearm when you start like that. And make sure that your head is right over the top of the shoulders. So this video we're going to talk about the movements of the neck or the cervical spine. And these are movements that we use a lot when we do warm-ups in yoga, just to kind of loosen up that area where we get tight in between the neck and the shoulders. But the first movement that we're going to use to get away from anatomical position is neck flexion. So neck flexion is moving into the front of the body with my head, and I'm creating this movement on the sagittal plane. So it's neck flexion, down on the sagittal plane, and the reverse of that would be neck extension, also on the sagittal plane. So neck flexion down, and neck extension back. Okay, now lateral flexion is ear to shoulder, back up, and ear to shoulder. Now you want to make sure that when you do that, if you're doing pure lateral flexion, there's no rotation, so you're not looking down toward the floor. You keep the head straight and just tip it over. This movement's happening in the coronal plane, so if there was a split right here, your head is moving right along that plane to get over toward your shoulder. And back the other way. And then the last one is rotation and rotation. So we would say right rotation or left rotation. And then that unusual little one that our cervical spine does is protraction and retraction, drawing back. And what you're watching for with protraction or retraction is that you really don't want to be in that position of protraction, especially if you're in a standing pose. You don't want the head to slide forward. You're really trying to foster a bit of retraction, but not so much that the neck gets straight. It's retraction to a point where there's just a natural curve in the neck. So let's talk about some poses where you're going to see these movements come in. Most of the time in yoga, the warm-up is just going to be some different neck movements. You might do lateral flexion with the hand on the side of the head. That one feels really good, especially when you push down through the opposite arm, because then you're creating scapular depression on this side, and that's going to open up the space between the base of the skull and the shoulder blade. That's that line that you're trying to open up. And back to center, and we'll go over to the other side. Tip your ear toward your shoulder, so we're in left lateral flexion. My left hand is going to rest gently on the side of the head. My right fingertips are reaching down to the floor to depress my right scapula. Take an inhale to come up. So neck flexion is actually a movement that we'll use in Jalandhara Bandha. So the bandha that we use to lock off the energy at the throat, a lot of times that's used after you do certain kinds of breath work. So let's go down toward the floor. And we would do our breath work, and then Jalandhara Bandha would look like that, or sometimes you'll see it done with a little bit of scapular elevation and neck flexion. Okay, the other one that you're going to see neck flexion and extension is in cat and cow. Of course, there's movement at all different points of the spine, but just watch the neck at the very end. When you're going into cat, the head goes into flexion or the neck goes into flexion. As you're moving into cow, the spine lifts up, the neck goes into extension. So it's neck flexion, neck extension. So lateral flexion is something that we typically see when we're doing side bends with the rest of the spine. Usually the head will follow along with that. So if I put my left hand down and start to move into kind of a classic side bend that we would do, my head is usually going to follow that natural arch that my spine is creating. Sometimes we'll add a rotation to look up toward the ceiling. So then it would be a compound movement, a little bit of lateral flexion with the cervical spine and some rotation. Take your inhale to come up. We'll try that over on the other side. Right fingertips down on the floor, left arm comes up. Feel the whole spine go into lateral flexion. The neck can stay in pure lateral flexion, or you can add a bit of rotation to lift your gaze. Inhale, come up to center. So anytime you get confused about what movement is happening, especially when you get those combinations of movements, think about what anatomical position would be and deconstruct that movement. So if my head was over this way and rotated up slightly, then we would have to unrotate and lift back to center. So you can see that combination of lateral flexion and rotation at the cervical spine. So the protraction and retraction is a really good one to practice down on your mat because you have the feedback of the floor. You can also do that with the wall behind you. See if you can stand with your back flat against the wall and bring the very base of your skull flat back to the wall. Bring your head forward away from the wall. See what that feels like in the front of the throat, and then pull the head back to the wall. Okay, so try that on the floor. Let's roll down onto the back. Tuck your shoulder blades underneath you slightly. And you're going to push your chin up toward the ceiling. And then draw the back of your skull down and slightly tuck your chin down. Feel how that makes the back of the neck nice and long. You feel like you're giving yourself a double chin when you do that. You're trying to find a neutral ground in between those. You don't want to be tucked back so far that the neck gets straight and your chin is really pulled back. You want to find a relaxed middle ground between those two. But that's an exercise that'll help you to understand what protraction and retraction of the cervical spine feels like. So those are the movements of the neck or the cervical spine, and then next we're going to be going down to the scapula, the shoulder blade. Thank you. Namaste.